We were broke down, so it was a real slow start today. Got paid to take a little bit of a nap. It was great. Went down in the woods, start working, and I was a hook tender, so I was pulling cable. And right off the bat, just got 2 or 3 drags up the hill and wound up having a log getting bound up and fractured or broke, and a piece went flying and caught me in the left side of the head.
And I probably looked away for 2 seconds at the most, and I looked back and I saw him take 2 big steps, and for Kevin, he's a big tall kid, 2 steps is quite a bit, and he was just kind of stumbled and just went down. First thing I noticed when I came up on him is he had the blood coming out of his ear already, and that was the first thing I said. I was like, Kevin's hurt. Kevin's hurt pretty bad, and I wasn't very calm about it, I know that.
So I had my radio turned on my pickup, listening to him skid. I heard Creath actually say, Kevin's been hit, he's down. And then he says, and there's blood coming out his ear. So I immediately, my phone's on my dash, I immediately dialed 911. I was just able to tell him that land the helicopter at the Blacktail parking lot. They were kind of shocked that I could say that. And so we were only about a quarter mile from that spot.
We received a call for a logger that had been injured up at Blacktail Mountain. We responded in Alert 1. The flight time is very minimal up to Blacktail due to just a short distance. I think our flight time was probably 8 minutes. As we were flying over the scene, we noticed that there was a group of loggers on the mountainside surrounding a co-worker.
We were all just trying to keep him under control, because by that point he had gained consciousness again.
They wanted to get him out of the brush as soon as I could. I said, keep him still, hold his head still, alert's on his way.
And we started working our way down towards where he was from the road. He was probably 100 yards from the road. And the branches and debris from the logging was incredible also.
I relayed to my partner. I was verbalized it, but he was already thinking that we're going to need some other form of assistance to move this patient back up the hill.
We could see that he was awake, but he was confused. We noticed he had blood coming from his head. Our initial assessment was very rapid. We could tell that he had quite a significant head injury at that time. I immediately got on the phone and to Flathead County Dispatch and requested Two Bear. To get him out would have been really difficult to do.
When the call came in, we were able to be off the ground in less than 10 minutes.
I did a quick head to toe. Basically, it was an isolated injury to the head. He had a lot of facial bruising on the left side, also blood from the left ear, which was also very, wasn't as thick as normal blood, so it's pretty indicative of a skull fracture. I also called the ER charge nurse with the cell phone, let them kind of know what we had and that it would be a full trauma. I started the IV, Eric started setting up for his airway, getting his intubation equipment out and ready, so that when we were ready to give medications, he would be ready to do the airway also.
I would have to say the crew, or the EMTs there, were so professional. You wouldn't even have thought it was as serious as it was, as calm as everything was on that site. And I actually asked the question when they gave him one shot, and the EMT said, I said, what's that going to do? And he said, that's just going to calm him down a little bit. And then he filled his syringe again and shot that into his IV. And he said, that's going to make him quit breathing. Right then I realized, holy cow, we've got a big deal. And seconds after he gave him the drugs, Kevin was paralyzed. He just went limp.
The next challenge was getting the patient to the top to the alert aircraft. At that point in time, we could hear Two Bear Air coming across the valley. You could hear them. And that was a very, it was a good sound to hear.
Then secured him the rest of the way on the litter with seat belts. We got the monitor on him and had everything basically done about the time that Two Bear arrived. At that time I told Eric, I said, why don't you go back up to the aircraft with the equipment?
Decided that I would go down with our Cascade bag, which is a device we can put backboards and litters inside of and hoist up to the helicopter. The hoist was uneventful, it was spot on. Rob did a great job. Gabe delivered me right to the spot. I got off the hook. And when I asked Leon what we had, Leon looked at me and in no uncertain terms said, he's taken a blow to the head. I've paralyzed him. I've intubated him. My O2's about running out and we need to go.
All he needed to do was maintain that airway, make sure it didn't get pulled out, and to ventilate the patient at a rate of 12 a minute.
And they came in, delivered the hook right to my hand. As I came up off the ground with the patient, I immediately started bag valve masking him.
Got him in, got everybody secured. Once everybody's secure, I got the O2 hooked up to what they already had and continued bagging them. And Will had actually bagged them on the way up as we were hoisting them.
As soon as he lifted off the ground, I grabbed the remaining equipment and worked my way back up to the road where a pickup was waiting for me to bring me up to the landing zone. We secured him in our aircraft, and at that time I was on the phone with our charge nurse in the ER again, telling him what our ETA was going to be.
They made an hour and 45-minute drive into an 8-minute flight.
When he arrived in the emergency room, he was evaluated by an emergency room physician, by myself, and also by Dr. Schrammick, a neurosurgeon.
I was at the point where we were between surgeries, and so we were able to put the next surgery on hold, which was quite fortuitous. The CAT scanner showed that he had a fairly significant head injury and something that is called an epidural hematoma, collection of blood that's between the brain and the skull. And it typically occurs if there is a skull fracture that lacerates a small artery that is between the skull and the what we call the dura. And it can cause enough compression on the brain that if it's not attended to in a very rapid fashion, people can actually die from this.
We noted that one of his eyes was under a great deal of pressure, so one of our ophthalmologists came over and released some tension on the eye to decrease that pressure.
We had the room ready to go, and we were able to get Kevin up there right away. And we were able to perform surgery to relieve the pressure and take the blood clot out and stop any bleeding.
He was also seen by the ear, nose, and throat service for some damage to his inner ear, which was later repaired.
It was probably 4 or 5 hours into the shift. One of the other flight nurses came up to us and said, "Hey, your patient's upstairs." We kind of dropped what we were doing and walked upstairs, and sure enough, there he was in his room with the tube out of his mouth, talking to family, and sitting up in a chair.
Myself and Leon just walked out of the room. I mean, I think we were floating.
He went to our rehab unit where he was seen by another physician and another team.
Physical therapy, they're fantastic guys there and did a great job taking care of me. And they shipped me off to Craig in Denver. Was afraid, I guess, that it was going to be permanent. I was going to be disabled. Wasn't going to go back to work. I was pretty rude to a few nurses, from what I'm told. I'm sorry. I'm just super lucky to have come back as far as I did.
If it was a ambulance, we're an hour and a half to town. So it was without a doubt a fatality without the teamwork that we had there.
I don't know if he could have got this any more seamless. If somebody on the outside looking in watches this operation, they'd have thought all of us work together every day.
They're just so extremely good at their job. The nurses and the flight medics, they know what to do, when to do it, how to do it. They don't doubt themselves. If they doubted themselves, it would, I might not be here today to talk to you. Extremely internally grateful for them.